Hi, my name is Karina Solis, and I'm attending this conference to expand my knowledge on mental health diseases and disorders, as well as share my story as a medical professional. My work is based on improving mental health in young adults, focused on college students and non-traditional college students. This practice also welcomes all of the LGBTQ community as well as a licensed clinical psychologist. My goal is to guide patients into a positive way of dealing with mental illness, such as clinical depression, anxiety disorder, attention deficit disorder, bipolar disorder, eating disorders, and mood disorders. Throughout my years as a clinical psychologist, I have encountered a large amount of cases pertaining to anxiety disorder. In the past year, 400 out of 800 patients were dealing with this disorder in many forms alongside other types of mental illnesses. Therefore, 50% of my patients have been diagnosed with anxiety disorder. Anxiety is the apprehension of danger, filling a person with fear over the future. An anxiety disorder occurs when this mental state dominates behavior. It is usually an acute response that includes restlessness, tachycardia, and shortness of breath. Other symptoms include paranoia, increased heart rate, sweating, trembling, fatigue, and overall psychological tension. Treatment commonly includes cognitive behavioral therapy, and if symptoms do not improve within the first 6 weeks, buspirone, an anti-anxiety medication, is prescribed. Treatment duration depends on the patient. Most often, therapy and medication follow young adults well into their careers. For illustration purposes, I will describe one particular patient that I have been treating for 2 years. 23-year-old female, Hispanic, working class. In the past, she has suffered from depression, panic disorders, and bipolar disorder. My final diagnosis was attention deficit disorder and anxiety disorder. So my recommendations included the medication buspirone. I also recommended Adderall and, of course, cognitive behavioral therapy sessions. So in general, anxiety is an issue that many people with high demands are faced with, regardless of age. My practice is focused on college age individuals because it is a stressful time in people's lives, and symptoms are new and can be overwhelming. I recommend to patients that they try to focus this energy on something positive, such as staying active, avoiding drugs and alcohol, reducing caffeinated beverages, and making sleep a priority, and of course, eating healthy. Some contribution of this issue is the high demand of our lifestyle. Moments of relaxation are often missed. Taking care of our mental health should be a priority, and we need to remind our patients of this as health promoters and educators. I recommend that other health professionals are not so quick to prescribe medicine. Find out the real cause of the problem and discuss prevention, maybe further their education. A major issue that has still not been solved or understood in the connection of this disorder is the connection of this disorder occurring with others simultaneously. There hasn't been enough research done for this particular topic.